Hello everyone, my name is Tanya Flores-Solney and I manage marketing campaigns for the healthcare practice here at West. Thank you for joining us for today's webinar, Taking Automated Member Engagement to the Next Level with TEC Pathways. Before we get started, just a couple of housekeeping items. You've joined the webinar in listen-only mode, which means the audio line is muted. If you'd like to submit a question, you may do so using the question pane located in the control panel on the right side of your screen. You may submit a question at any time and they will be answered during Q&A at the end of the presentation. And any questions we're not able to get to, we will follow up with you via email. So these are today's learning objectives. Throughout the presentation, you'll learn how TEC Pathways helps extend your investment in population health by delivering what we call the last mile of member communication. So the last mile of communication is essentially the area where other systems are falling short. When we talk to our customers, they're telling us that their EMR and PHM systems are really great for segmenting and identifying patients who need outreach, but these systems simply aren't robust communication platforms. They can't tell them how or when to best engage those patients. And this is where TEC Pathways comes in. Okay, let's get started. Your speaker today is Colin Roberts, Senior Director of Healthcare Product Integration. Colin's role at West is basically to bring the latest and greatest in communication technology to the healthcare market. And with that said, Colin, take it away.
Thanks, Tanya. And thank you to everyone for attending this product demonstration. This here is a list of the topics that we'll be covering today. I'd like to start with providing a high-level overview of West and our engagement center. I'll discuss some of the challenges that we've heard in the marketplace, and then the bulk of the time will be spent demonstrating our new solution, TEC Pathways. Finally, then we'll wrap up with some general Q&A. So to begin, for those of you who are not familiar with West or don't know us all that well, we are a technology-driven communications leader operating in all market segments: retail, banking, telecommunications, and even healthcare. We're headquartered in Omaha, Nebraska. We're publicly traded and have nearly 10,000 employees worldwide. A few quick facts about us. We're the world's largest conferencing and collaboration company under our brand name Intercall. We support over 64 billion minutes annually in our hosted and managed IVR. We spend more than 1 billion outbound notifications each year and are the backbone of the 911 infrastructure in North America, hosting nearly 300 million calls annually. And finally, via our Health Advocate business unit, we provide healthcare advocacy services to nearly 40 million covered lives. So our position in the healthcare space is this: those organizations are able to activate and engage their members in meaningful ways across the care continuum outside the clinical setting are best positioned to lower costs, improve outcomes, and really drive revenue. At West, we approach the payer market leveraging our engagement center suite of assets, which are organized into really these three solution sets. Technology-enabled communications. This is our suite of intelligent outbound notifications and inbound automated call center technologies. Clinically managed services in the middle there. We have over 7 medical directors on staff, over 100 RNs, a large number of diabetic educators, as well as a host of many other clinical licensures. And then finally, our analytics and business intelligence. This solution set is more about using analytics to improve member engagement rather than segmentation and stratification. For example, we use analytics to really identify and then the best time of day to launch an outbound message in order to reach the maximum engagement from a particular member type. Now, we take our engagement center set of solutions and we really point them at the foremost conspicuous areas of member engagement, starting with call center modernization. In the more consumer-centric healthcare market, we believe it's critical for organizations to provide an effortless experience when their members call in. So if you think about a 1-800 single front door, we are experts in creating this effortless experience for our organizations, many organizations across the country. The next three are really centered around the care continuum itself. With, for example, routine care, these are prevention and wellness type of engagements, trying to drive support healthy behaviors in your member base. transitions of care, this is where we assist provider organizations in capitalizing on the TCM revenue while at the same time trying to reduce readmissions, which can lead to high penalties. And then chronic care, finally, we help organizations really engage the sickest of the sick in driving better outcomes overall. The goal here is really to provide empathetic automated outreach to really drive a more effortless member experience. So in conversations that we've had with our clients and prospects, we consistently hear very similar questions or challenges, similar to these. Apply automated communications intelligently. Most engagement that we see today still involves people calling people. Proactive, even when automated communications are used, it's generally for an ad hoc or a departmental initiative, really to achieve a single metric or a single outcome. Better coordinate or align with their care plans. Members are often receiving different information depending on whom they talk to or depending on what part of the organization is trying to speak with them. And then finally, control or visibility with little administration. Typically, there isn't really any great visibility into the communication that's happening between members and caregivers across the organization. And so it's because of these challenges that we created TEC Pathways. TEC, or TEC, stands for Technology-Enabled Communication, and TEC uses automated communications to engage members between visits. TEC is about having the right communications at the right time and in the member's channel of choice, whether it be through voice, text, email, video, or even through remote monitoring devices. TEC Pathways is a feature of West's Engagement Center that helps us take those automated communications and make them smarter, more coordinated, and more personalized. So for example, TEC Pathways provides a user interface that allows you to really select the tasks that you'd like to automate, sequence them alongside other interventions or automated tasks that align against either a care plan or a clinical guideline. That's why we call it a pathway. Schedule the pathway for maximum engagement. This is really the set it and forget it concept of a TEC pathway. We can then allow you to monitor members' adherence to the pathways that have been prescribed to them. And finally, really manage by exception those members who aren't following or engaging with the pathway as prescribed. So before I jump into the demo, I'd like to kind of set the stage. I want to, for a minute, have you imagine a member like Beverly, or Bev. Bev recently had hip replacement surgery and is being discharged today with a long list of discharge instructions. Things like making sure she picks up and takes her medications according to schedule. She schedules a follow-up appointment with her primary care physician, and that she's really on the lookout for any complications that she may incur due to her surgery. And you'll see at the bottom here, there is kind of a pathway that's already been built with respect to the touches that you as an organization may wish to have with Bev based on that. So given that foundation, I'd like to jump into TEC Pathways and see how we can use it as a better way to manage a member like Bev. So I'm going to log into the system, and where I'm actually going to log in first is into our administrative portal. And what this does is this allows us to see at the highest level some pathways that have already been created. And I'll get into those in just a minute. But what I first of all, let me zoom a second, I want to show you what we mean by pathway again, kind of to hit this point home. When I click on the new pathway button, you'll see that there's really the continuum of care that we've been speaking to again. We organize all of our communication interventions or automated outbound notifications under these three umbrellas. So again, routine care management would be prevention and wellness type touches. Transition care management, again, would be for patients like Bev, who recently were discharged with hip replacement surgery. And chronic care management would be for those patients who obviously have a chronic condition. So then what we do is we organize further underneath these the domains of communication interventions that we may want to enable underneath each umbrella. So if we're going to build a discharge pathway for someone like Bev, we'll click in the discharge or the transition, and you'll see on the right-hand side several of those domains that we were speaking about earlier, whether it be a reminder domain, a reminder type call, an assessment or a survey, or maybe even medication type touch points. So the first thing that we're going to do is we're going to name this pathway. and then I want to go out and add an assessment. So you'll see here I can click from the drop-down and pick a couple of different options with respect to the assessments or surveys that we want to send out. Because we're doing a discharge, I'm going to start with the discharge assessment. And you'll note that there's several questions here that are already pre-scripted that will be launched against the patients that receive this pathway. I'm going to leave them all checked because they're relevant. And I want to schedule this for the first day post-discharge. So I'm out on discharge today. Tomorrow I will receive this phone call. When I click Add, you'll notice on the timeline that the discharge assessment has been added to that timeline. Now we also know the follow-up care is critical. So let's add an additional nudge for the patient or for the member to schedule their discharge follow-up call with their primary care physician. Let's schedule that nudge to be 3 days post-discharge. And I click Add, and again, you can see that that's also starting to add to the timeline. We've now got the creation of what we're calling our pathway. Let's add one more touch point, maybe midway through the 30-day period. Well-being assessment, similar questions to the discharge, but in a little bit different flavor. And let's set that one for, let's say, 14 days post-discharge. So again, I've got now 3 different communication interventions that have been essentially strung together against this timeline to create a pathway to try and drive better engagement with a patient like Bev post-discharge from the ER or an inpatient stay. I could continue to add multiple items to this if I wish to, but I think 3 is enough for the demo here. So when I click Save, you'll notice here on my panel, I now have the Discharge 1.0 pathway saved that's now available for me to prescribe against this member panel. You'll also notice that there's several circles here that are not filled in. Well, those are the specific touch points that we just added and strung together. So you can see each one and how they may actually fare once prescribed against a panel of members. Again, up here you can see how they're doing. These are really good touch points, and that's why they're showing up as green. You can also get the overall score as it relates to how the pathway is being effective if you just look over here on the right-hand side. So how do I actually use this to better manage a panel of members or a caseload? Well, I clicked on the home page, and now I'm back to a different view where I've got a view of several members that I may be managing that have different cases that I may be looking at them for. Imagine this being maybe 100 or 200 members deep. And each different circle on here is a separate and distinct outbound communication intervention that's going out on my behalf to these members without me having to do anything to intervene. That's really, again, the set it and forget it concept of TEC Pathways. So if you think about Bev, remember Bev, we've got that TCM pathway that we just created. You can see here that she actually engaged within the discharge assessment. She took that successfully. But this one's red here, so she may not have actually engaged or scheduled her follow-up appointment. So we would want to maybe touch point with her to ensure that she gets that PCP visit scheduled and actually goes to it, to keep her away from maybe readmitting or having other complications, more costly interventions. So you can see here that that would be a touch point that I may want to have if I was her case manager, to really reach out and say, hey, Bev, let's get that scheduled. There's a couple of ways in which I could do that. I could give her a phone call, but Wes prefers to work within the patient's or the member's channel of choice. And so what I mean by that is we have the ability to send these notifications out in either the voice channel, which would be an outbound phone call, or in the SMS channel, which is text messaging, or even in email or snail mail. In this instance, or in this example, let's pretend that Bev prefers text messaging. So what I could do is I could click on this SMS text button, and it will open up West's SMS Assistant product. And when I click Compose, I can go in and search for Bev, find her there, and now I can either type her a text message or I could send her a canned response. So this is reminder to schedule your follow-up appointment with Dr. Johnson. Feel free to call this number to schedule his visit. If I were to send that out, and I were to pull my phone up here, you should be able to see that it came through on my phone. It's not coming up. So when I go into my text messages here, you can see here, Beverly, this is a reminder to schedule your follow-up appointment with Dr. Johnson. If I were to respond to that, it would come back into this queue, and I could handle that conversation more generically with the member. Now, one last question that we always get with this is, how do we get our member panels enrolled in Pathways? And there's a couple of different ways in which we can do that. The first one is to accept a file from our clients that really indicates every single member that they want us to apply and what pathways we want them to apply against them or prescribe for them, and we would load and launch. The other way in which we can do that is we could create an integration between the clinical system of record and our system, so where we could actually do API calls and integration points in to grab the information as necessary as triggering events occur. And then the third way would be if I was actually a case manager working with a member on the phone. I could click on this Enroll Member or Enroll Patient button and select from this drop-down. You can see different pathways that are now available for me to prescribe against that member. So if we look at that discharge, you now again have that communication timeline that we were talking about. I could go ahead and fill in the appropriate information here. So let's talk about grab information about them. I could add in a family caregiver if I so chose to. I'm going to delete that so that I don't get two text messages. Concur that they are giving me permission to use automation to communicate with them, and enroll them in the program that way. You now see Joe Jones here. He has several items that he's available to, that are available for him to interact with. And then what you'll also notice is now that Joe Jones has been enrolled in the program, he'll start receiving text messages according to the program that have been prescribed against him. The last thing that I want to show is we also have the ability then to engage and see how these members engage over a period of time. So if we look at this Austin Young example, I can click into Austin, and now I'm like at the patient detail or the member detail record. And if I go back in time, I can see a historical touch point or a historical view of all of the touch points that we've had with this member. I've got demographic information here. I can see which pathways they're enrolled in, and I can even hover over these different conversation points to see what the conversation has been with this member over the month, including an example of that SMS conversation that we just had a few seconds ago. So with all of that being said, that is, in a nutshell, TEC Pathways. So what did we see here? You're actually able to curate disparate communications and address specific conditions or diseases states over time. You can prescribe these pathways to drive member-centric engagement toward a stated outcome. These can be personalized. What that means is we can deliver these prescribed communications at the member level and in their channel of choice, like voice or text or email, like we talked earlier. Schedule and sequence to reduce the administrative burden and add scale. You can manage these folks, provide insight into which members are really requiring escalated interventions, and really streamline the reporting to really automatically update member records with relevant information. So with that, I'd love to take a couple of questions if there are any, Tanya.
Sure. Thank you, Colin. We'll begin answering questions submitted during the presentation now. Just as a quick reminder, you can still submit questions via the question pane on your right-hand side. So the first question I have for you is this cloud-based software or does it require installation?
This is all cloud-hosted and managed software. So the UI that you watched us walk through is a web-based tool, and it could be integrated into your systems given the right touch points if we have. But everything that you saw here is on our site that's in our cloud that's hosted and managed by West.
Okay. Another question here I have for you is, how does this work with what I already have? I don't want another system.
Yeah, so we get that a lot. There's this concern about adding additional systems to the learning curve of the case managers. Many times when we're talking with our clients, the last thing they want is a third system or a second system. So we have the ability to really integrate. West is one of our strong suits, is really the means in which we integrate into systems. We've got over 3,000 integrations in the marketplace today, clinical integrations, whereby we can push and pull information as it relates to these engagements. What that means, I guess, to answer the question, is you can continue to work within your systems, assuming we can get the right integrations in play, and the triggers will still occur in the background behind the scenes.
Very good. So this looks like a technical question. What are the integration options to get my patient data into the TEC Pathways system?
Yeah, so I touched on that a little bit earlier. I kind of probably blurred over that. So there's really three different ways. The one I just spoke about briefly a minute ago is really through API integrations. So we would understand kind of where to point and pull from. That would be either through a HL7 integrations, et cetera. Or what we also could do is do an integration work through really batch files, where we could accept a file on a doesn't have to be nightly basis. It could be an hourly basis, or even a day, even more frequently or less frequently than that, where we would receive a file, kind of an ACD file, add, change, or delete, to update the information that we have in hand as it relates to the notifications that we need to be sending out. And then in turn, we can also publish everything to a report or a file that we could then turn back to you as the client, who then could upload into your system of record as needed.
Thank you, Colin. We've got quite a few questions coming in now. One person asks, how is this sold, by the user or annual contract?
Both. I think we would need to look at how the system would be intended to be used and the volumes of members that would be leveraged against. But we are looking at it both from a PMPM or as an annual subscription by number of pathways that you select.
Sounds good. So I think we have time for just one more question before we wrap up. So this person asks, can you elaborate on how TEC Pathways makes clinicians more productive?
Yeah, so the goal here really is to take and automate those tasks that are, I don't want to use the wrong word, mundane. They're the things that, so if you think about a nurse care coordinator or a nurse case manager, many of them didn't go to school to learn how to leave a voicemail, and a lot of the times, unfortunately, that's what they're spending their time doing, is trying to dial for dollars or trying to dial these members to try and get them engaged. So one of the aspects that TEC Pathways does is takes some of those tasks that are more mundane in nature and allows us to string them together to make them a little more efficient and allow them to really only be handling or managing those calls or calls with those members that really need them the most. Those higher risk members or those members who have a higher need from a coaching standpoint. So in some respects, it's an efficiency play. At the other end of it, though, is many of the times those case managers, you're limited by the number that you can have. And their panels of members that they're managing is finite. So what this essentially allows you to do is add some scale for additional surveillance options against maybe those lower risk members. So that way, again, those case managers can really be having meaningful conversations with the members that really need it the most, the higher and medium risk members that really need some assistance. So I would say those are probably the two ways in which your staff can become more productive by using a system like this.
All right, thank you, Colin. So that's about all the time we have for today. If we didn't get to your question during the presentation, we'll respond to you offline via email. Feel free to reach out to us with any other questions you may have. And the next week, you can expect to receive a link to view and share the presentation with your colleagues as well. Thanks again for joining us. Have a great day.